early. It's time to wake up. 5 in the morning. Today for them to cut my foot off. They're gonna cut my foot off today, Lily. What do you think about that, huh? Oh, there's Daisy. You gotta wake up. What's the matter? It's already like 9 o'clock in the morning. We were supposed to be there at 6 a.m. What do the Wiener Dogs girls think? Too early in the morning? I know. There you go. Wake mommy up. That's a good girls. Hey guys. So it's Thursday morning, the morning of my ankle surgery. And we are down at Washington Regional Hospital in Fayetteville. Now we did learn yesterday that Lorelei, this lady here, who's my wife, can't go into the hospital because of the pandemic.
Only the patient.
Only the patient. So what they're going to basically have to do is
To
call her, we can give her updates, and then down the road here in a few hours they'll tell her, hey, you know, he should be ready to pick up by 9 o'clock or something. Right now it's what, 5 a.m. in the morning. Surgery's at 9 o'clock. Hopefully I'll be back home by
I don't know.
noon, 1,
They will
2.
call me when to pick it up, so I need to travel like 30 or 45 minutes to be back here.
Right. But the big situation is nobody can go in the hospital but the patient itself. So I'll be all alone without Lorelei.
No, but I give him a pack over something to do.
Yeah, she gave me a carry bag.
Every time the doctor say anything,
I
I
feel
ready.
I feel like I'm 8 years old and my mommy packed me a lunch. So
All right, I will update you later about, because the doctor will call me when the surgery start, and after the surgery,
it's
and
over.
later they will call me again when to pick up David.
And I'll bitch and complain later about how much it hurts.
He will be in the cast. What's that?
Yes.
Cast. All right. See ya.
All right. So I have officially checked in with the surgery scheduling staff. So now I'm in the lobby waiting area where there's nobody. In the years past, when I've come here for surgery, this area would be packed with patients and visitors. But as you can see, as of today, not so much. So hopefully here in a few minutes, they'll get me back to my pre-surgery room and out of the waiting area.
Badly torn, and so I used another tendon in there to reconstruct it. And so once this all heals, I think his ankle's going to be stronger, and it's going to quit hurting once he's over the surgery part of things. Of course, it's going to be pretty sore for a while from this, but he's in recovery and waking up. But when he's a little more awake and getting closer to ready to leave, then they'll give you a call. Okay?
All right.
All right.
Thank you so
Thank
much,
y'all.
Doc.
You bet. Y'all call us if you need anything.
All right.
Okay?
Thank you so much.
All right.
Bye-bye.
Bye.
Oh, that's the... Oh, finally. It's so stressing, you know? Like, when you're having your loved one in a surgery and this pandemic is really, really annoying. Because all the time, I'm always there with David every time he has a surgery. But it so sucks, you know what I'm saying? That no one family can get in there. And now finally it took like they called me like 9:41 and now it's 10:55. So probably like, you know, maybe an hour, a few minutes to walk before they call me or search my name. So that's a relief. But I still want to see my David. So here I'm home stuck. They would just call me when just get ready, but it's really frustrating. All right, that's for the update for now. Hi guys, it's 12:04 now. It's an update for David. The nurse who's assigned was taking care of David in a recovery room at the Washington Regional Hospital. They called me that David was taking care of his pain, which he has a problem earlier. Well, it's really hard, he got a surgery, so I'm still worried about David. Like, I really want to see. It's different than I used to before, that I go and talk to him and see his checking. Well, there's a lot been a surgery with David. I always there. This is the first one. I get the pandemic, so they just keep updating me. And the doctor said that the nurse just called me. They said that she's gonna move David there in another second recovery room, which is about the room that for discharge, like maybe an hour or 30 minutes. They will call me to update me what time they will ready to pick up. Yeah, as I said, I can't get in there. It's really, really hard. So yeah, that's for the update, guys, and see you later.
All right, so here I am back in the post-op step-down room. So apparently the surgery went well, no issues there so far. The pain is definitely there. When I woke up a little bit ago, it was a good 10, but it's slowly starting to come down with the aid from some medication. So right now we're probably a 5 or a 6. I can tell that it's definitely going to be painful over the next few days. But I've already called Lorelei. She's on her way down. She'll be here in about a half hour. And I am good to go home. Just got to get dressed, take a pee, and we are good. And then we'll let you know how things go over the next few days. YouTube channel.
That's Brooke, the nurse.
Yeah.
Thank you for your service.
You're welcome.
She didn't even beat me.
Okay, I'm gonna get back in your back seat and grab those instructions for you.
Oh,
Okay?
yeah. Yeah.
Okay. I guess you can
Yeah.
hit a button to set that, or do
I got it right here.
Okay, so here is your prescription. Okay, that's for Percocet, which is oxycodone. It has some Tylenol in it. Okay, have you taken that before?
Yes.
Okay. Do you have pain medication already at home?
Oh.
Okay, so just take one or the other. Don't take anything extra with Tylenol in it, okay?
Okay.
While you're taking this. You'll have to drop this off at the pharmacy. Here's Dr. Plyman's phone number, his clinic number, so that's where you're going to call if you have any problems, okay?
And they're scheduled to follow up.
Yes, they want to see you in 10 to 14 days, and they were closed for lunch, so you'll
Yeah.
have to call them later, or they may call you. But if you haven't heard from them in the next couple of days, go ahead and call.
Okay.
But that's where you call if you have any problems. Now, if it is after hours, a weekend, anytime you can't get through to there, you're going to call the main hospital number right here and have Dr. Plyman paged.
Okay.
So you can go back to your normal medications.
Starting tonight?
Okay. Oh yeah, just whenever. You might be careful with your aspirin because that can cause you to bleed a little bit more. So no driving or any machinery for 24 hours. So no mowing the lawn or riding, any of that stuff.
Okay.
You can go ahead and progress your diet. Just start off light.
Okay.
You want to look for signs of an infection like fever over 101, chills, any excessive bleeding, or excessive pain, you need to call and let them know, okay?
Yeah.
So here's Dr. Plyman's instructions. Some of this will apply to you, some of it won't, but he wants you to keep your leg elevated as much as possible in the first week, okay?
Okay.
The more you leave it hanging down like this, the more it's going. It could possibly bleed.
Okay.
And these
Okay.
tend to bleed pretty well.
It must be higher than your heart level when you're laying.
Okay. Any
So-
ice or anything?
Yeah. So what he says is prop it up on at least 2 pillows, toes above your nose. So keep it up high, and that will prevent swelling, prevent bleeding. You can put
Okay.
ice packs on there, but just make sure they're the kind that aren't going to leak, because you want to keep that clean, dry, and on until your follow-up
Okay.
appointment. If it gets wet or bleeds through, you're going to have it rewrapped, okay?
And don't take any of this off.
Don't
right?
take any of it off.
Okay.
And you can shower, whatever you want to do, but you're going to have to either wrap
Bag
that in
it.
a bag or hang it over the edge of the bath or whatever. We're not doing any wooden shoe. Don't worry about any of that. We talked about that. There's no pins, so we're not going to worry about any pins. So you want to look for any red streaks coming up your leg. That would be a sign of infection. Look at the color of your toes. The more you hang them down, the bluer they're going to kind of look, which is okay. If it's dark blue, black, extremely red, or completely white, those are signs that it's either not getting enough blood flow or it's getting infected. Okay?
Okay.
So be on the lookout for those. That's about all. Any questions about any of that?
No.
Okay.
My wife doesn't have any questions
And you
about
won't be
this?
leaving him for 24 hours, right?
No. I'll
Okay.
be 6 weeks taking care of him.
Okay. So he's on drugs, so he can't sign. So we're gonna have you sign.
It's okay. I think we're done.
Oh, David. You okay? You know I can't help you, right?
Yeah.
You want the other one? The stroller?
No.
Think that is okay?
Let me just get up here.
I prepared a chair for you. You want to sit down? No. So how is really hurt, right? Tell it. Don't
Yes,
feel
it hurts.
It hurts really.
It hurts
What?
very much.
Yeah. Oh, he's got there his foot.